Which of the following conditions is characterized by a sudden and rapid loss of kidney function, usually due to decreased blood flow to the kidneys, kidney damage, or urinary tract obstruction? A. Acute renal failure. B. Chronic renal failure. C. Iron deficiency anemia. D. Sickle cell anemia. The correct answer is A. Acute renal failure is a sudden loss of kidney function, often reversible if treated promptly. What is the hallmark laboratory finding in iron deficiency anemia? A. Elevated hemoglobin level. B. Low serum ferritin. C. Increased MCV. D. High vitamin levels. The correct answer is B. Iron deficiency anemia is characterized by low serum ferritin levels, indicating decreased iron stores in the body. Which type of anemia is caused by a lack of vitamin B12 and/or folic acid, resulting in unusually large red blood cells? A. Sickle cell anemia. B. Thalassemia. C. Megaloblastic anemia. D. Hemophilia. The correct answer is C. Megaloblastic anemia is caused by a deficiency of vitamin B12 and/or folic acid, resulting in enlarged and irregularly shaped red blood cells. Sickle cell anemia is an inherited blood disorder characterized by which type of abnormal hemoglobin? A. Hemoglobin A. B. Hemoglobin S. C. Hemoglobin C. D. Hemoglobin F. The correct answer is B. Sickle cell anemia is caused by abnormal hemoglobin S. This causes red blood cells to become rigid and sickle-shaped. What is the primary defect in thalassemia? A. Decreased production of hemoglobin. B. Abnormal red blood cell shape. C. Deficiency of iron stores. D. Decreased platelet function. The correct answer is A. Thalassemia is characterized by a decreased production of hemoglobin, leading to anemia. Hemophilia is a genetic disorder that primarily affects which component of blood clotting? A. Platelets. B. Fibrinogen. C. Factor VIII or IX. D. Thrombin. The correct answer is C. Hemophilia results from a deficiency in clotting factor VIII or IX, leading to impaired blood clotting. Which of the following is a potential cause of chronic renal failure? A. Increased blood flow to the kidneys. B. Obstruction of the urinary tract. C. Sudden loss of kidney function. D. Decreased kidney damage. The correct answer is B. Chronic renal failure can be caused by long-standing conditions such as urinary tract obstruction, leading to progressive loss of kidney function over time. What is a common symptom of iron deficiency anemia? A. Jaundice. B. Easy bruising. C. Pallor. D. High fever. The correct answer is C. Pallor, or pale skin, is a common symptom of iron deficiency anemia due to decreased red blood cell production. In sickle cell anemia, the sickle-shaped red blood cells can lead to which complication? A. Increased oxygen delivery. B. Vaso-occlusive crises. C. High platelet counts. D. Normal life expectancy. The correct answer is B. Sickle-shaped red blood cells in sickle cell anemia can cause vaso-occlusive crises, leading to blocked blood flow and tissue damage. Patients with thalassemia may need regular transfusions of which blood product? A. Platelets. B. White blood cells. C. Packed red blood cells. D. Plasma. The correct answer is C. Patients with thalassemia often require regular transfusions of packed red blood cells to maintain hemoglobin levels and treat anemia. Which lab test is typically elevated in acute kidney failure due to kidney damage? A. Blood urea nitrogen, or BUN. B. Red blood cell count. C. Platelet count. D. Hemoglobin level. The correct answer is A. Less than break time equals 1s greater than. In acute renal failure, blood urea nitrogen, or BUN, levels are typically elevated because the kidneys can't effectively filter waste from the blood. In sickle cell anemia, what amino acid substitution occurs in the beta-globin chain of hemoglobin? A. Glutamic acid to valine. B. Valine to glutamic acid. C. Histidine to lysine. D. Asparagine to threonine. The correct answer is A. Sickle cell anemia is characterized by a mutation where glutamic acid is substituted with valine in the beta-globin chain of hemoglobin. Which type of hemophilia is caused by a deficiency of factor VIII in the blood clotting cascade? A. Hemophilia A. B. Hemophilia B. C. Hemophilia C. D. Von Willebrand disease. The correct answer is A. Hemophilia A is caused by a deficiency of factor VIII in the blood clotting cascade. In chronic renal failure, what electrolyte imbalance is commonly observed due to impaired kidney function? A. Hyperkalemia. B. Hypernatremia. C. Hypocalcemia. D. Hypercalcemia. The correct answer is A. Impaired kidney function in chronic renal failure often leads to hyperkalemia, as the kidneys are unable to effectively excrete potassium. What is the characteristic shape of red blood cells in thalassemia syndromes? A. Target cells. B. Sickle cells. C. Bite cells. D. Helmet cells. The correct answer is A. Target cells are a characteristic shape of red blood cells in thalassemia syndromes. They appear target-like. Which clotting factor deficiency characterizes hemophilia B? A. Factor VIII. B. Factor IX. C. Factor She. D. Factor 13. The correct answer is B. Hemophilia B is caused by a deficiency of factor IX in the blood clotting cascade, distinguishing it from other types of hemophilia. Which of the following is a potential cause of acute renal failure? A. Urinary tract infection. B. Hypertension. C. Dehydration. D. Anemia. The correct answer is C. Dehydration can lead to decreased blood flow to the kidneys, causing acute renal failure. Which iron-rich food is commonly recommended for patients with iron deficiency anemia? A. Broccoli. B. Red meat. C. Pasta. D. Bananas. The correct answer is B. Red meat is a good dietary source of iron, which can help in the management of iron deficiency anemia. What is the primary treatment for megaloblastic anemia due to vitamin deficiency? A. Iron supplementation. B. Intramuscular vitamin injections. C. Folic acid tablets. D. Blood transfusion. The correct answer is B. Intramuscular vitamin B12 injections are necessary for patients with megaloblastic anemia due to vitamin B12 deficiency. In sickle cell anemia, which organ is commonly affected due to blockage of blood vessels by sickle-shaped cells? A. Liver. B. Lungs. C. Spleen. D. Pancreas. The correct answer is C. Sickle cell anemia can lead to splenic sequestration crisis due to blockage of blood flow in the spleen. Which type of thalassemia results from a mutation that decreases the production of beta-globin chains? A. Beta thalassemia. B. Delta beta thalassemia. C. Alpha thalassemia. D. Gamma thalassemia. The correct answer is A. Beta thalassemia is characterized by a decrease in the production of beta-globin chains. In hemophilia, which factor is deficient in hemophilia A? A. Factor 2. B. Factor 8. C. Factor IX. D. Factor 13. The correct answer is B. Hemophilia A is caused by a deficiency in factor 8 of the blood clotting cascade. What is a common genetic mutation seen in sickle cell anemia affecting the beta globin gene? A. Heterozygous deletion. B. Point mutation. C. Insertion mutation. D. Frameshift mutation. The correct answer is B. Sickle cell anemia is caused by a point mutation in the beta globin gene, leading to abnormal hemoglobin. Which vitamin is essential for converting homocysteine to methionine in folic acid metabolism? A. Vitamin. B. Vitamin. C. Vitamin C. D. Vitamin D. The correct answer is B. Vitamin B12 is needed for the conversion of homocysteine to methionine, a crucial step in folic acid metabolism. What is the primary treatment for hemophilia B? A. Desmopressin. B. Factor 8 replacement. C. Factor IX replacement. D. Corticosteroids. The correct answer is C. Hemophilia B is treated with factor IX replacement to restore the missing clotting factor. Which of the following is a characteristic feature of acute renal failure? A. Polyuria. B. Presence of renal cysts. C. Gradual and progressive decline in kidney function. D. Sudden and rapid loss of kidney function. The correct answer is D. The hallmark feature of acute renal failure is a sudden and rapid loss of kidney function. This can be due to decreased blood flow, kidney damage, or urinary tract obstruction. What type of anemia results from not making enough normal hemoglobin because of a gene mutation affecting alpha or beta globin genes? A. Iron deficiency anemia. B. Megaloblastic anemia. C. Sickle cell anemia. D. Thalassemia. The correct answer is D. Thalassemia is characterized by a deficiency in the production of normal hemoglobin chains, either alpha or beta, due to genetic mutations. What is the primary treatment for iron deficiency anemia? A. Intravenous iron infusion. B. Folic acid supplementation. C. Regular blood transfusions. D. Oral iron supplementation. The correct answer is D. The primary treatment for iron deficiency anemia is oral iron supplementation to replenish iron stores in the body. Which clotting factor deficiency characterizes hemophilia A? A. Factor 8. B. Factor IX. C. Factor V. D. Factor 7. The correct answer is A. Hemophilia A is caused by a deficiency in clotting factor 8 within the blood clotting cascade. What is the primary defect in sickle cell anemia at the molecular level? A. Mutation in the alpha globin gene. B. Mutation in the beta globin gene. C. Mutation in the gamma globin gene. D. Mutation in the delta globin gene. The correct answer is B. Sickle cell anemia is characterized by a mutation in the beta globin gene, leading to the production of abnormal hemoglobin, known as hemoglobin S. Which vitamin is commonly prescribed as a supplement for megaloblastic anemia caused by vitamin B12 deficiency? A. Vitamin C. B. Vitamin A. C. Vitamin B6. D. Vitamin B12. The correct answer is D. Vitamin B12 supplementation is commonly prescribed to correct the deficiency seen in megaloblastic anemia due to vitamin B12 deficiency. In megaloblastic anemia, what neurological complication can occur due to vitamin deficiency affecting the spinal cord? A. Peripheral neuropathy. B. Ataxia. C. Cognitive impairment. D. Depression. The correct answer is B. Vitamin B12 deficiency in megaloblastic anemia can lead to neurological complications such as ataxia, due to spinal cord involvement. Which type of thalassemia results from a lack of alpha globin chain production, leading to excess beta globin chains in the hemoglobin molecule? A. Alpha thalassemia. B. Beta thalassemia. C. Delta thalassemia. D. Gamma thalassemia. The correct answer is A. Alpha thalassemia results from a lack of alpha globin chain production, causing an excess of beta globin chains in the hemoglobin molecule. What is the characteristic shape of red blood cells in sickle cell anemia during a crisis? A. Anisocytosis. B. Poikilocytosis. C. Schistocytes. D. Sickle cells. The correct answer is D. Sickle cells, with a distinctive crescent shape, are characteristic of sickle cell anemia during a crisis, leading to vaso-occlusive events. Which of the following symptoms is commonly seen in thalassemia intermedia due to moderate hemoglobin chain imbalances? A. Severe anemia. B. Hepatomegaly. C. Splenomegaly. D. Cardiomegaly. The correct answer is C. Splenomegaly is a common symptom in thalassemia intermedia. This is due to red blood cell destruction in the spleen and the body's efforts to keep hemoglobin levels up. What is the hallmark laboratory finding in chronic renal failure? A. Elevated blood urea nitrogen and creatinine levels. B. Decreased blood urea nitrogen and creatinine levels. C. Increased glomerular filtration rate. D. Normal kidney function tests. The correct answer is A. The hallmark lab finding in chronic renal failure is elevated BUN and creatinine levels due to decreased kidney function. Which type of anemia is characterized by a deficiency of both alpha and beta globin chains, leading to abnormal hemoglobin production? A. Thalassemia. B. Iron deficiency anemia. C. Megaloblastic anemia. D. Sickle cell anemia. The correct answer is A. Thalassemia is characterized by a deficiency of either the alpha or beta globin chains, resulting in abnormal hemoglobin production. What is the primary defect in megaloblastic anemia due to vitamin B12 deficiency? A. Impaired DNA synthesis in erythroblasts. B. Decreased red blood cell production. C. Elevated iron levels in the body. D. Increased oxygen carrying capacity of red blood cells. The correct answer is A. The primary defect in megaloblastic anemia due to vitamin B12 deficiency is impaired DNA synthesis in erythroblasts, leading to the formation of abnormally large red blood cells. Which clotting factor deficiency characterizes hemophilia C? A. Factor 8. B. Factor IX. C. Factor She. D. Factor 13. The correct answer is C. Hemophilia C is caused by a deficiency of factor She in the blood clotting cascade. What is the primary treatment for thalassemia major? A. Blood transfusions. B. Iron supplementation. C. Vitamin injections. D. Hydroxyurea therapy. The correct answer is A. The primary treatment for thalassemia major is regular blood transfusions to manage the anemia. Which type of anemia is characterized by an excess of iron in the body, leading to organ damage and dysfunction? A. Hemolytic anemia. B. Aplastic anemia. C. Sideroblastic anemia. D. Iron overload anemia. The correct answer is D. Iron overload anemia is characterized by an excess of iron in the body, which can lead to organ damage and dysfunction. What is the primary molecular defect in sickle cell anemia affecting the beta globin gene? A. A point mutation resulting in the substitution of valine for glutamic acid. B. A deletion mutation in the beta globin gene. C. An insertion mutation in the alpha globin gene. D. A frame shift mutation in the delta globin gene. The correct answer is A. Sickle cell anemia is caused by a point mutation in the beta globin gene, resulting in the substitution of valine for glutamic acid in the hemoglobin molecule. Which of the following is a characteristic feature of hemophilia B? A. Deficiency of factor 8 in the blood clotting cascade. B. Deficiency of factor 9 in the blood clotting cascade. C. Deficiency of factor 11 in the blood clotting cascade. D. Deficiency of factor 13 in the blood clotting cascade. The correct answer is B. Hemophilia B is characterized by a deficiency of factor IX in the blood clotting cascade. In which organ does iron accumulate in iron overload anemia, leading to damage and dysfunction over time? A. Liver. B. Spleen. C. Lungs. D. Brain. The correct answer is A. Iron overload anemia causes iron to build up in the liver, damaging it and causing dysfunction over time. What is the primary treatment for iron overload anemia to reduce iron levels in the body? A. Iron chelation therapy. B. Blood transfusions. C. Vitamin supplementation. D. Erythropoietin injections. The correct answer is A. The primary treatment for iron overload anemia is iron chelation therapy. This reduces iron levels in the body and prevents organ damage. Which of the following is a potential cause of sickle cell anemia crisis? A. Dehydration. B. Infection. C. Excessive physical activity. D. All of the above. The correct answer is D. All of the listed factors can trigger a sickle cell crisis, leading to pain, organ damage, and other complications in individuals with sickle cell anemia. Which type of anemia is characterized by defective production of alpha or beta globin chains, resulting in abnormal hemoglobin synthesis? A. Thalassemia. B. Sickle cell anemia. C. Megaloblastic anemia. D. Hemophilia. The correct answer is A. Thalassemia is a type of anemia. It's caused by a defect in the production of alpha or beta globin chains. This leads to abnormal hemoglobin synthesis. What is the primary treatment approach for managing acute renal failure caused by decreased blood flow to the kidneys? A. Intravenous fluid resuscitation. B. Long-term dialysis. C. Kidney transplant. D. Nephron-sparing surgery. The correct answer is A. Intravenous fluid resuscitation is one of the initial treatments for managing acute renal failure, to help improve kidney perfusion and function. Which type of anemia is characterized by a deficiency of clotting factor 8 in the blood clotting cascade? A. Hemophilia A. B. Hemophilia B. C. Hemophilia C. D. Von Willebrand disease. The correct answer is A. Hemophilia A is caused by a deficiency of clotting factor 8 in the blood clotting cascade, leading to impaired clot formation and increased bleeding tendencies. What is the primary deficiency in megaloblastic anemia due to a lack of folic acid? A. Red blood cell production. B. White blood cell production. C. Platelet production. D. Hemoglobin production. The correct answer is A. Megaloblastic anemia due to folic acid deficiency primarily affects red blood cell production, leading to the formation of large and immature red blood cells. Which of the following is a potential complication of thalassemia major due to severe anemia and ineffective erythropoiesis? A. Iron overload. B. Hypercalcemia. C. Hyperkalemia. D. Hypoglycemia. The correct answer is A. Patients with thalassemia major are at risk of iron overload. This is due to frequent blood transfusions. These transfusions are needed to manage severe anemia and ineffective erythropoiesis. What is the primary defect in hemophilia C affecting the blood clotting cascade? A. Factor VIII deficiency. B. Factor IX deficiency. C. Factor She deficiency. D. Platelet dysfunction. The correct answer is C. Hemophilia C is characterized by a deficiency in clotting factor 11. This factor plays a crucial role in the intrinsic pathway of blood clotting. Which organ is primarily affected by iron accumulation in iron overload anemia? A. Liver. B. Kidneys. C. Lungs. D. Spleen. The correct answer is A. Iron overload anemia mainly affects the liver because it's a major iron storage site. This can lead to organ damage and dysfunction over time. Which of the following is a characteristic feature of sickle cell anemia crisis? A. Vaso-occlusive pain. B. Easy bruising. C. Prolonged bleeding. D. Yellow skin discoloration. The correct answer is A. Sickle cell anemia crisis is characterized by vaso-occlusive pain. This is due to sickle-shaped red blood cells blocking blood vessels. This blockage leads to tissue ischemia and pain. In what type of anemia do patients experience fatigue, weakness, and shortness of breath due to a decreased capacity of the blood to carry oxygen? A. Iron deficiency anemia. B. Thalassemia. C. Sickle cell anemia. D. Hemophilia. The correct answer is A. Iron deficiency anemia reduces hemoglobin production. This leads to less oxygen in your blood. Symptoms include fatigue, weakness, and shortness of breath. Which of the following medical conditions is associated with a defect in the normal production of clotting factor 8, leading to prolonged bleeding? A. Acute renal failure. B. Sickle cell anemia. C. Thalassemia. D. Hemophilia A. The correct answer is D. Hemophilia A is caused by a deficiency in clotting factor 8. This results in impaired blood clotting and prolonged bleeding.